I'm guessing it's not exactly known yet what the long-term effects of COVID-19 are, but we have been hearing and seeing in the headlines that there are issues that can linger with the heart. Do you want to explain this for laymen like myself and our listeners possibly who might not understand?
Absolutely. So you're right. A lot of the data regarding the long-term effects of COVID in terms of the heart are still unknown. But we have learned a lot about COVID in the heart. We know that COVID-19 really causes a wide spectrum of disease, anywhere from asymptomatic patients to those with critical life-threatening illness. And the same is proving to be true from the heart. It can cause a wide range of issues with the heart. There's actually a small study that came out of China kind of early on in COVID that showed up to 12% of patients that had COVID had some evidence of cardiac damage related to COVID.
Now, I would think, as someone with a obviously vague understanding of this, that it would be more lung-oriented. So what's the relation between the lungs and the heart with COVID?
Excellent. Yeah, that's a good question. So what we've learned is that COVID can cause damage to the heart in a number of different mechanisms. One of those mechanisms actually involves how COVID is taken up by the cells in the body. So there's something called an ACE receptor. And that's actually located not only in the lungs, but in the cells of the heart. And that's one way that the virus gets into these cells and causes damage. Now, outside of just the way that the virus gets in, whenever you have a viral infection or any kind of infection, you can get this overwhelming release of what we call cytokines. It's kind of an inflammatory response. So that can also damage the heart, cause weakening of the heart in some cases. There's also a concept called stress cardiomyopathy. So somebody who's really sick, whether that's from COVID or from another illness, can get a temporary weakening of the heart muscle just because of the overwhelming illness that's taken place. We also learned actually that patients with pre-existing heart conditions also are more prone to the serious effects of COVID. And we know that's true not only for COVID, but other viral infections such as the influenza. Those patients with pre-existing illnesses, especially cardiac, are just more prone to the adverse complications of the viral infection.
What would you recommend, in your expert opinion, for people with those pre-existing conditions to do during these uncertain times?
Yeah, so the pre-existing conditions we're talking about, anything related to the heart, whether that's patients who have had a history of heart failure, coronary artery disease or heart attacks in the past, but not only with specific heart issues, but if you've got risk factors for heart disease, such as diabetes, pre-existing lung conditions, I think those patients really need to be a little bit more cautious. They are at higher risk, so certainly wearing the mask, trying to distance themselves, do everything they can to try to reduce their risk of getting the infection.
What kinds of measures are being taken at Baptist Health to watch for these issues and make sure that patients are still safe?
So we have a number of measures in place in the hospital, limiting patients' families that come in. We make sure that everybody has a mask on. Specifically in the cardiac arena, any patients that we bring in for elective procedures or even sometimes urgent procedures, we're doing COVID tests so that we know that when we bring these stable outpatients in for tests, that they've tested negative, and we're not exposing our other patients, which is particularly important, when we're having patients around other cardiac patients.
Is there anything that I did not ask or that we didn't touch on that you wanted to add, Doctor?
The other thing would be the long-term effects of a COVID infection in terms of heart disease. It's a bit of a difficult question to answer. We're still learning about the long-term effects. We don't have any good studies yet that tells us what we can expect long-term, months to years after somebody's had a COVID infection. What we do know is that whenever you have inflammation or infection of the heart muscle, you get something called myocarditis, and that can set you up for scarring in the heart. So there's some early data out there to say patients that have had a COVID infection, particularly with heart involvement, may have a higher incidence of heart arrhythmias, may also have a higher incidence of scarring or heart failure. The data is really lacking. I think in the next 12 to 24 months, we'll get a lot more data and better understand what the lasting cardiac effects of COVID will be.
Stay tuned as WBONTV will continue to update listeners and viewers about the long-term effects of COVID and other stories from Baptist Health Richmond. For Channel 9 News, I'm Marissa Hempel.